This video will give you details of the Kindred Academy Treating Babies courses. In particular, it's going to show you an insider's view so you can really see what's in the course, and we'll do that by actually showing you parts of the footage from the course so that you can see what you will learn and how it will enable you to go on and be able to treat babies. Now, there's a single principle behind all of these courses, and you're seeing that here with this footage, and that is the courses are based around actual clinic footage in the osteopathic clinic in Australia where I work. Now, where this came about is because all the way back in 2013, my associates were asking me to teach them how to treat babies. And so they would sit in with me while I was treating babies so they could learn how to do that. However, there was a problem with that, and that is it wasn't particularly structured. They'll get to see what happens with baby on that particular day. It's very hard for me to teach them on the spot during that actual treatment. I've got to focus on treating the baby, focus on communicating with mum and dad, and so I can't just turn to one side and spend 10 minutes explaining something. And so what happened was I started filming footage so that we could take that at a different time and run that in terms of a tutorial. So I could give voiceovers so we could play the footage of the actual treatment and what I'm talking to in terms of mum and explaining what I'm doing. And then we'll play that footage again, but with a voiceover of me explaining why I chose those words with mum, why I did that particular technique. And it proved hugely effective in terms of teaching them how to treat babies. So much so that other osteopaths around Australia asked for me to teach them. So in 2015, I ran an attendance course where the osteopaths would come and I'd teach them how to treat babies. And we had 5 of those courses run back to back, sold out. Now what happened is through those courses, I started to develop more and more footage in order to teach these osteopaths how to treat babies. And then I started to really improve the footage by using techniques like 2 separate cameras to show angles and using zooms and close-ups. And what happened was by the end course, the very last course, I had a huge amount of footage that I was starting to show them at this attendance course. And it kind of was like, wow, this is a bit weird. These people are turning up in person for me to show them video footage. And so what I realized was this format of online footage was actually more effective than that in-person course. Now, there's always value in getting together to learn on an attendance course. But the difficulty when you're learning about babies is that you're not actually learning on the baby when you go on an attendance course. You actually practice on another adult and it's not the same. Now the tutor will probably arrange to have a baby at that course for them to demonstrate, and it'll be a half-hour session where they show a treatment. But you're not being shown different techniques because baby won't accept that. You can't just say, oh, I'm going to do this technique on baby. Baby will just crack it. They won't like that. The tutor has to show what the baby needs at that time. And that's useful for you, but you don't get hands-on, so you don't get the reality of that. And you have to take whatever baby wants to be allowed to be done at that moment. So with all that in mind, that's when I realized the effectiveness of this video footage. And so that's when I really started to expand the amount of footage that we've had and put together a structured course. And with that structured course, we can show you the different bits that you need to be able to do to treat babies in terms of techniques, but also in terms of handling. So how do you handle a baby when they're doing well? How do you handle a baby when they're a bit grizzly? What are the different positions and postures that you need to be able to transition so that you can keep baby happy, so that you are able to continue with the treatment? How do you get ahead of the game so you're actually using those different transitions before they get upset? Because often after they're too upset, you can't go on with treatment. So I sat down and went through all of this footage, just shot so much footage and then broke it down into structured tuition. As you can see here, there's a huge amount in this particular course that we're looking at, which is the core syllabus. There's 7 courses in total in the Kindred Academy suite of baby courses, and we're looking at one particular one here, the core syllabus, and there's over 70 video tutorials in this course, split into these different modules, where we're going to look at how we take the history, whether that's in terms of the very start, what's happening during pregnancy, what's happening during the birth, what's happening afterwards, whether that's in terms of the actual first treatment, where you're taking that initial history, or whether it's in terms of the follow-up. Then, of course, we need to go through and do our examination, whether that's supine examination, seated examination. We need all these different ways of examining. And here in the video, you are seeing a clip from the examination supine module, including one of the protocols there. It's important you have a protocol to get started so you know what to do. Now we'll move on and show a clip from the module 4 examination seated, because it's important to be able to treat in that position, because babies won't always lie down for you. So you can have these different tools in your toolkit. Of course, examination of the cranium is also really important, which is why there's a whole module on that, including 10 separate video tutorials going through different things, including infant anatomy, and in terms of obviously how we go about examination, both in the supine position and in the seated position. There's of course a module on tongue tie, very important these days. Parents are particularly concerned about tongue tie and latch. And then of course we need to go and talk about treatment principles. What are the different treatment principles that apply to babies? How can you take the skills that you may already have and adapt them to working with baby? And then of course we need to go through a whole bunch of different techniques so that you can work with baby, whether that's working on the cranium, whether that's working on the body, whether that's working in the seated position, the supine position, whether you're going to move baby around a little bit when you work with them, and work ways of helping baby when they're really easy to work with, when they're falling asleep, and when baby is unhappy and grizzly and they've got reflux or colic, or they've got sleep problems and they're really tired, or they need to feed, or simply that they're so young and vulnerable they want to be close to mum. In those situations, we need to understand how to position baby so we don't freak baby out and don't freak mum out. So we need to learn all of those different things. We need to understand the principles of whether we start treatment straight on the head. Mum brings baby in. I brought the baby in because there's a problem with the head. I want you to fix their head shape. Do we go straight to the head? No, we start elsewhere. We often will start at the sacrum or away from the head to allow baby to warm up to our touch, and also to allow mum to also understand what's going on and not freak out if you touch an area and baby starts crying. So we need to understand all of those different things, and I need to show you that with actual video footage, not just talk about it like we're doing here and see little clips. We need to actually run through the different things. We show you the footage and what I actually do, and then we'll run through that footage again, explaining why I did certain things. Why did I change it up there? Why did I not wait any longer? Why did I pick baby up? Why did I walk around with them? If I'm walking around with them, how am I treating? Can I still treat? Yes, you can, but you need to adapt what you're doing. What we're communicating to mum or dad, so they understand treatment is still happening. They're starting to relax and not thinking, oh, this is a complete waste of time. Their nervous system will start to relax. If it's amped up, baby picks up on that. Then it's harder to treat. So we need to know all of these little tricks of the trade within a structured framework where we walk you through from history to examination to treatment, and then we cycle back through that again. Because when you're taking examination, you can be asking mum about things. Okay, I'm feeling this a little bit here. Did baby have this happen during birth? Or has this happened? And so that we're redoing that history, which adds to the value of the examination, helps with our treatment, but also it's communicating to mum and dad what's going on so they feel really comfortable. However, do not worry, because this course will give you all those skills. How do we know it works? Because since 2016, 628 students have gone through these courses. So we know they are effective and they know they work, and those fellow practitioners like yourself, whether it's osteopaths, craniosacral therapists, we've had massage therapists do this course, variety of different people. We've had doulas and midwives bring their skills from knowing how babies work, their vast experience, and then getting the hands-on skills from this course to move forward and treat those babies. And from the feedback they've given us, we know this course works. This footage works. This is the closest you will get to treating babies without treating them, so that it prepares you the most you can. The only way to get better than this is to do an apprenticeship where you're able to sit in and actually sit there day in, day out and do this work with babies. And that's really hard to get. Other than that, this is your number one option. How do we know that? Because our students have told us how effective this has been for them, and they've gone on and are treating babies all around the world. Those 628 students were from 42 countries around the world, and they are out there helping babies day in and day out using the skills learned on this course. And it's important that I tell you about those other students so that you know this is achievable for you. This is not pie in the sky. This is so close. This is right at your fingertips. You just have to follow through with the training so that you have the confidence, you have the skills, so that you too can be out there treating and helping these babies. So I hope to see you inside the course, and until then I will leave you with this baby who is teaching us that if we go slow, yes, we can help those babies, but in return, they will help us in our life as well.